Hi, and welcome to today's episode of Women's Health Unwrapped. Today's topic is one that we should all be better informed and aware of. So I really hope that you enjoy the conversation you're about to listen to and that you take lots away from it to improve your personal health goals. We're diving into blood sugar and metabolic health with my guest, Bev Mazza, who is a registered nurse, board certified nurse coach and an integrative health consultant who uses continuous blood glucose monitors, which you'll hear us talk a bit more about, CGMs, along with a functional medicine approach to help women navigating perimenopause and menopause to make positive metabolic shifts. Now, as you'll discover through the episode, this conversation is important for lots of reasons, both as we navigate menopause to perhaps try and deal with the onset of lots of symptoms, including things like low energy and fatigue, brain fog, weight gain, trouble sleeping, as well as for our future health. So this is a really, really important topic for both feeling well now and ensuring that we have a long, healthy life ahead of us. So welcome to the podcast, Bev.
Thank you. I'm so excited to be here and talk about this really important topic for women's health. I can't wait to dive in.
Me too. This is a topic that I love and have done some personal education on to help me navigate my own menopause as well as helping clients. So I'm really looking forward to getting your insights and knowledge. But just to get us started, I'd love to know a bit about your healthy lifestyle and what your most impactful habit is in your toolkit.
Great question. I do live a fairly healthy lifestyle. I wouldn't say that was always the case for me. I kind of initiated my health journey, actually through investigating some like skin rashes I was having, of which led me to kind of investigate, personal care products, environmental toxins as such, which opened the door for me into looking at like what are these ingredients, what are impacting my health, which really then opened the door to looking at what's in my food, how is my food impacting how I feel, any symptoms I might be experiencing. So this has really been a, 15 plus year journey that led me down the avenue of really understanding like holistic healing modalities, integrative health, functional medicine. And when you start to go down that avenue, often it's a domino effect, as I'm sure you can attest to, and many other women can, is like you don't know what you don't know, which is what I learned, even from, being a nurse. And then once you do know it, you really can't turn a blind eye to it. So that really opened up my eyes to realizing, whether it was a time in my life where I was struggling with my weight and I realized I was doing that very punitively or just feeling like I needed to eat less calories and I needed to push myself more at the gym, to really realizing I needed to look at this whole picture of what my body was and what my body needed. And I really came to that understanding at a period of time where I was experiencing chronic pain and had to really surrender to that. And no really better way to describe that, to really realize like this wasn't about one thing. I was kind of searching for like what's this one thing to fix me, and what I really learned is like it's not that. So I feel like even in the context of what we're going to talk about today,
Mm.
it's always going to be a whole body game. And that's what really, when I'm supporting my patients as a nurse, my private clients, I'm always looking at everything through like a whole body approach and what are all these aspects that are impacting our health. So for me personally, that has been to a point where I no longer consider myself necessarily doing healthy habits, which might be like a really big statement to say, but it's really just a way of my being, meaning I really prioritize, nutrient dense foods. And I really think about the composition of each of my meals and my snacks. Thank goodness, not from a caloric standpoint anymore, but from, what are the actual ingredients that I'm looking at? And then how is this impacting my body, my blood sugar for one, because I'm sensitive to that. But am I getting enough sleep? And if I'm struggling for sleep, what tools do I know that are at my disposal that I can support my body? And that might, it might have to do with, am I overly stressed right now? What do I need to pay attention to? Am I at a particular point in my cycle? I'm a perimenopausal woman, right? So I'm just like, okay, like what might be going on that I need to lean into a little bit more? Prioritizing exercise and not making it punitive. That has really been a big one for me in my relationship with my body, of always being like exercise was just, I need to burn calories, I need to lose weight. And in midlife was like, yeah, that's not working. I never really liked exercise until I found a modality that really worked for me. I enjoyed it, didn't feel punitive. I saw body composition changes, and now I love it. And it's just part of my routine. And meditation and mindfulness, which has kind of been my linchpin for many years. And I think actually has really supported me to kind of transform this lifestyle away from habits and things I have to do to just a way of being and who I am, which at this point in my life, as a middle-aged woman, like feels really fantastic and really supports me too when things get rocky and things get more difficult in life as they do. That I've kind of worked really hard to establish this foundation and knowing that, this way of living is really important and it's not something that I'm willing to sacrifice or, toss aside, even when things get really difficult.
No, I totally get that. And that is very much what I'm about. I did an episode, I think maybe about 3 months before we recording this, on my own healthy habits. And a
Mm-hmm.
big emphasis around that is that those habits become a part of who you are. Like you're explaining, is that they just flow into your life. And I have been asked many times, is it hard to, keep to those habits, to have the willpower to live healthy? Because a lot of people who want to be healthier look upon it as something that is going to be a struggle and often mean being boring or, having to restrict things and so on. But exactly as you've explained, being healthy is an identity, it's who you are, and so those things just become embedded into your life. And there's lots of things you mentioned there which I know we're going to touch on, and I think that's a really nice way you've set up our conversation for the episode, talking about things like meditation and nutrient dense food and exercise and finding something that works for you, but also that bigger piece of how these things are interlinked and go hand in hand to create the health output that you want, which is very much a part of what I'm sure we're going to get across in this episode, is that it isn't any one thing in isolation. And obviously this topic is related to metabolic health, your metabolism, which I'd love to explore a little bit more about. But to get started, can we just dive into blood glucose, blood sugar, and what that actually is?
Yeah, absolutely. So definitely a big topic. I think most people don't necessarily think about blood sugar until maybe their physician tells them it's an issue. I'd say that's probably the most common. And by issue, typically it might be something that reveals itself on annual lab work. So fairly standard here in the US. And I know you're an international audience, but it might be fairly common that your doctor will do a yearly panel. How extensive that is can vary, but usually a blood sugar level is on that as part of a general metabolic panel. If you had it fasted in the morning, then you can consider that your fasted glucose. The other important marker to kind of establish like how are you managing your blood sugar is through, in the US, we call it hemoglobin A1C. And so that is a rough 3-month estimate of what your blood sugar has been over that 3-month period. So it would not have been impacted if you had eaten that morning, or things like that. So it really is a more like comprehensive look. Not perfect like most lab tests, but it's what we have right now until we basically brought in continuous glucose monitors, more and more readily available, which are going to show you actually in the moment glucose changes. But from the concept of your blood work, typically your doctor might say, your blood work is within normal limits, right? Or they might say you're pre-diabetic, or they might say you're actually a type 2 diabetic. So that's the spectrum that we're kind of measuring on the laboratory work. And so people can find themselves, either, just looking at it and saying, okay, doctor said this is fine, which sometimes it might be. Sometimes I've seen in practice is people are told it's fine, but they don't necessarily look at the number itself. And that number could be suggestive of you might have early insulin resistance if you're at that top of that curve. If that number has been trending up, that's another sign. Or some doctors don't necessarily feel like there's much to do in that pre-diabetic state. And we watch and see until you become diabetic. And or general advice of if you just eat healthy and exercise, you'll be able to, improve this. And that, as we know, and, being as health professionals, is really vague advice for people. They don't really know necessarily what to do with it. Some people feel like they're already doing that. Other people might come at it where they're like, I'm wondering, I get really tired at certain points of the day. Like, could that be my blood sugar? Or I get lightheaded, I get dizzy. So people come at this with different approaches. I've even worked with a client who had headaches and was wondering if those were associated with potentially blood sugar swings, mood issues. So it really opens up a whole door of, is this related to blood sugar imbalance throughout your day? It might be, it might not be. We don't really know that until we look at it. And we look at that using a continuous glucose monitor, which had been here in the US, has been around, started with using it for type 1 diabetics, obviously, to assist with decisions in insulin management, even then onto type 2 diabetics as well. And more recently, I think as it's come into the wellness space, we are using it with pre-diabetics, and then people are even using it through health optimization. I know there's a whole faction of people that are using it for athletic performance. So people are kind of getting their hands on these. In the US in 2024, they came on the market over the counter. I'm not sure where they are internationally, if that's the case too. But that's really been a game changer for people to be able to get their hands on these as well. It's a sensor that's inserted into the back of your arm. There's no needle left inside of you. And it basically sends readings to an app on your smartphone and shows you what those readings are in real time, which you really can start to see what these patterns are over the course of the day, what these ups and downs are, and then most importantly, what do they mean? Are they significant? And that's the big one where I feel like there's worth that discussion, especially if these become more readily available, because, having data and not knowing what to do with it isn't necessarily beneficial either. So I do have that conversation with people too. It's really, what are we going to do with this data? What are we looking for? What is our motivation for using it? And I think that's a really key factor to see if we do find something, how are we going to then leverage and use this to assist with habit change and behavior change off of what we're seeing.
Yeah, so whether or not someone's wearing one of those monitors, just explain what is happening inside of our bodies, like what is glucose, doing, and what would then be perhaps those frequent spikes or peaks. We talk about the blood sugar roller coaster, don't we? Like what is actually happening inside of us. And you mentioned insulin, and so I think it'd be good to explain, because then I would love to lead on to why this is such a big topic right now in the menopause and midlife women's health space.
Yeah, so just really in its simplest form, we consume glucose in the form of like carbohydrates, as far as like that macronutrient that we're talking about. So whether that's within your kind of like, we think of like our white breads, our white pastas as such, our fruits, our obviously candies, cookies, sweets, ice creams as such, our complex carbohydrates, our oats, our brown rice, our quinoa, just listing off a few things here, just contrasting those with maybe a tablespoon of olive oil, right? Or a seed, right? Something that might be more like of healthy fat, or a piece of chicken, right? A protein, a piece of fish. We're really talking about this carbohydrate family of which when we consume, it's broken down in the body, right? It's digested, and ultimately then the glucose component of it, because it breaks down into sugar, is then released out into the bloodstream. So when you go to your doctor and you have that laboratory test and they're checking that sugar, they're measuring it in the blood. And so we're like, how much sugar should be there? And so that number can give us a good understanding of, is there too much sugar, for lack of a better term, that's hanging around? And we know that that's not good, right? We know what those downstream consequences are of someone who has, a type 2 diabetic, right? The microvascular changes that can happen, the increased cardiovascular risk, obesity, changes to our eyes, changes to our kidneys, changes to circulation. So everybody, we have these kind of familiarity of what that sort of downstream, and we want to try to intervene before that happens. So when the blood sugar is floating around, we know there's an issue. And the thing is with blood sugar is like, it can't go anywhere without an additional hormone, which is insulin, which you had mentioned. So in response to that, our pancreas will release the hormone insulin, which basically comes out into the system, and it has to escort the glucose into the cells where it's going to then be used for energy. So what happens with that over time, my favorite analogy is really thinking of it as like a lock and key, where your insulin is released. It's the key running around in the blood, and it basically needs to go to the cell door, unlock it, and help the glucose go in. Otherwise, the glucose is just scrambling around on its own. It can't go anywhere. And then that's what we're measuring. So sometimes over time, what can happen is sometimes eventually if the insulin is always going up, because we know every time we're consuming a carbohydrate, we're having a glucose spike, and that signals to the pancreas, okay, insulin, you got to get out there and do your job. We can have raising insulin levels, which is definitely a concern because insulin itself is a fat storage hormone. So if we have chronically elevated insulin levels, or if we're constantly triggering insulin spikes, it's really hard for the body to release fat and release weight. So this is a very common picture for many women who are struggling with weight loss as a blood sugar like dysregulation. Or sometimes just I would say that the lock and the key is a little bit of a rusty combination, meaning the cell door, it's just like, I'm overwhelmed. There's so much sugar. You're trying to unlock my door and I'm just not going to listen to you anymore. I'm done. Right. And that's insulin resistance, as we call, where it's resistant to take in that sugar. So as an end result, it's floating around in your blood. And so we're going to capture that on a laboratory test, or in the case of a continuous glucose monitor, actually this small little fluid space underneath your skin called your interstitial fluid space. So when you're wearing a CGM, as I tell people, we're not measuring the blood glucose. We're measuring the glucose in that fluid level. But there's been enough studies to show, and there's been a lot of research on this, it's a comparable number, so much so that, diabetics are using it and making treatment decisions for insulin based off of those numbers.
Yeah, so this whole process, it is a huge part of our metabolic health, isn't it? This is what is essentially, not fully, but essentially driving our metabolism. Would you explain it or like associate it like that?
Yeah, so it can be a factor for people. And I always like to say it's not for everybody, but there's definitely a lot of people are struggling with their metabolic health. And for some people and many people, your blood sugar regulation can have a lot to do with that. So whether or not you have the diagnosis of, prediabetes or type 2 diabetes, we don't have a good test to measure for quote unquote insulin resistance, though there is thoughts that this is a process that's maybe going on for 10 years before you even are diagnosed. So that is one of the reasons why I really like the monitor, because you can look for dysregulation. You might not find it, right? So I always like to preface that you might put on a monitor and it might be fairly unrevealing for you. But then that's great. If you feel good and then it's not part of your story, you can revisit it again. I always encourage people to kind of revisit it through perimenopause and menopause, because one of the reasons I like to focus on this group in particular is because that loss of estrogen, which, you had just touched on too, as we go through midlife and we go through those changes, we lose that protective property, which can make us more insulin resistant. So even if we're still following a healthy diet, even if we're still in the gym, even if we're sleeping well, we're doing all the things, just that hormone shift alone can kick many women over the border into a pre-diabetic state, which can be very disheartening, very frustrating, and very concerning because they don't know kind of what to do next. And part of my conversations with a lot of women around this is just having the understanding of this isn't your fault. It can be very emotional for women because they're like, I am doing all these things, and just really explaining that, this is a hormone shift that's going on. No, there's not one like quick fix to this. Even I would say with like hormone replacement therapy, that doesn't mean that that's necessarily going to be the right choice for every woman, or that it means that all of a sudden you're going to have ideal blood sugar regulation. Could it be helpful? Absolutely, if you're the right candidate for it. But like anything, circling back to how we started, it's usually not that one thing, but it's usually having that awareness that, and I'll even share this from my personal side. For me, when I started wearing a CGM, I had actually started using it because I was investigating if I had low blood sugar, because I had moments during my day where I just felt a little off after I ate, like a little maybe dizzy, a little lightheaded, wasn't quite sure what was going on, thought maybe it was food sensitivity. I mean, this has been going on for probably like 10 years, right? I mean, it's been some time. And actually found that I actually can spike quite high when I eat certain foods. And that what I was feeling was that quick increase in my blood sugar and then subsequent drop, even though it wasn't going into a dangerously low reading of any sort. I was able to correlate that feeling with instability in my blood sugar levels, and have been able to smooth those out subsequently, which has helped me feel better during the day, keeps my energy up, and ultimately, has improved my A1C into a very optimal range, which I'm happy about. But I'm very mindful of that, and I'm tracking that very closely. I have prediabetes in my family. I have diabetes in my family. So it's part of my family history. And as I obviously move through as a woman in her 40s, it's definitely something that's going to be on my radar to continue to track and monitor, because it's part of my health story.
Yeah, absolutely. And I think there was, and maybe there still is, a perception that type 2 diabetes is kind of a shrug your shoulders diagnosis. It's like, well, it's okay. I can, take medication. It doesn't really mean anything. You touched on some of the problems that can arise, even to do with your eyes. Like every single part of your body is affected by your metabolic health. And if you are diagnosed with type 2 diabetes, there are so many risks. I know someone, a friend of the family, who lost his legs because of diabetes and eventually, passed away only in his 60s. So it poses a lot of health risks, and it's also often a precursor to other illnesses and diseases. And we see these rising rates of many of those chronic illnesses and diseases amongst women, which we believe there's a lack of research, but some research around, that connection between our hormones and overall cardiovascular, brain, metabolic health, and so on. And, we are seeing increasing number of levels of type 2 diabetes to quite an alarming rate. There was some recent research just published in the UK, which showed that there'd been a 40% increase in just 5 years in the number of people diagnosed in the UK with type 2 diabetes. And that's younger than the age of 40. So, there's some research into even younger people, and a lot of stuff in the press, actually. I think when we're recording this, last week or maybe the week before was Obesity Awareness Week, and there's been a lot of things written and talked about the rising level of obesity and linked to that type 2 diabetes. So this is a really important topic overall for long-term health. But when we talk about women and midlife women especially, those changes that many are navigating through perimenopause can be difficult to navigate. I mentioned things like fatigue, just that low energy, inability to sleep, perhaps high stress. Many women change body shape and do put on weight. They feel as though they're carrying more fat, especially around their hips and their middle. And this can lead to lots of those women focusing on eating less. And as you touched on in the very beginning of the episode, we have to bring all of these different pillars of well-being together. However, we're kind of like the salmon trying to swim against the current upstream, because we've inherited these beliefs from a young age about, we need to look a certain way. That comes through dieting. Dieting means restriction and just counting the volume of what we eat and not focusing on the quality of what we eat, nutrient-dense food. So some of what, and I'd love you to expand on this, Bev, what I took from some research in preparation for the episode from Zoe, which maybe this is something separate we can touch on, is kind of the on-trend thing of CGMs and blood glucose. But Zoe have done a lot of research, quite a large volume of people, showing, that the way women's bodies respond to food changes as we get older. In earlier life, women do tend to have or experience less severe spikes in blood sugar levels as they age compared with men. However, as we get older, post-meal blood sugar levels increase, and these dips can, as you said, make us maybe feel shaky, really tired, hungry again quite soon after eating. And then in the longer term, those higher blood sugar levels can contribute to that higher risk of type 2 diabetes, as well as heart disease, stroke, and many other metabolic diseases. And blood fat levels increase as you get older as well. And the research found that women's fat metabolism changes during perimenopause. So, you touched on this very important part that I also talk a lot about of self-acceptance and compassion, because we are changing, and often it's such a intricate web of change. It's like, how do you get in and really, identify one thing, because everything is so interlinked. So I'd love to just explore a bit more around that, around what women, especially as they experience those menopausal hormonal changes, maybe seeing and feeling in relation to their blood sugar.
Yeah, yeah. Thank you for sharing all that research too. That's really important information to share with everybody. I think in the context with blood sugar, again, it's kind of that it's unseen, right? Until we might
Hmm.
have the data to look in the lab test to say. So if women are kind of curious, is this part of my picture? Then obviously you can check that. If it is part of your picture and you have that diagnosis, I think what's really important to understand about blood sugar, and I'm always educating around this, is yes, food is sort of a common driver of what is going to cause rises in your blood sugar, but there's also these other factors. So we're talking about like, how much are you exercising? What type of exercising are you doing? How much skeletal muscle mass do you actually have from a body composition standpoint? What is the quality of your sleep? What is the duration of your sleep? And then how are you managing your stress? And what I always like to come out of the gate talking about this is I hope that it relieves some of the stress around it's all about what I eat, right?
Yeah.
So when I work with both my patients or my private clients, of course, a lot of this focus is going to be on nutrition, but it's also equally going to be on these other aspects of your health. And one of the reasons of many that I do like the continuous glucose monitor is it can be quite revealing for women too, sometimes to step out and away from the scale and what their weight is, to purely just look at what is the balance in my glucose throughout the day, and then what are my habits. Maybe it's what I'm eating, but what are some of the other habits that might be driving this instability or causing these, suboptimal numbers? So for someone out of the gate, this might be, lack of tools for stress management. Like this might be the woman who's go, 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 very type A, plowing through her day, right? Maybe going to bed and then doing it all again and not having any space. And when you look at a curve of a woman like this, she might just kind of always have these elevated blood sugar levels. Or you might see they're a little bit lower, maybe on a weekend day where she was relaxing. But then those 5 days, where she's at work, you're 15 points higher out of the gate when you haven't eaten anything first point in the day, right? And so to see that differentiation, I found for a lot of people, it's actually kind of permission to start caring for themselves, maybe in a way they hadn't before through stress management. And I teach a lot around mindfulness and meditation. But I always encourage anybody to engage in any stress management practice that is going to support that parasympathetic nervous system, support the vagus nerve, right? So this is our relaxed state. This is the opposite of the go, go, go. This is the opposite of the survival. This is the other side of the nervous system, basically. That's our rest and digest. It's essential for digestion, right? To support optimal gastrointestinal functioning. It's essential for fertility. It's essential for immune health. We all know that those things kind of go offline when we're super stressed out because our body doesn't have an immediate need to focus on those. But it's really important from a blood sugar standpoint because when we are stressed, right, it sends a signal and our adrenal glands are going to release cortisol, which is the body's long-acting stress hormone, which basically sends a message over to our liver that says, please release your stores of glucose, which it has and everybody has, because I need energy. I need to get out of here. I need to get to safety. So, if that's going off all the time, which it is for many people, that's also a contributor of just these like kind of chronically elevated levels. So I'm a big advocate of actually finding time to support that parasympathetic and not just actually in the form of a lot of people are like, well, I exercise. I'm like, that's great, but that's a sympathetic, habit, right? Even though you feel better and it might reduce your stress. A lot of women will do that. They say, that's my mental health. I have to get out and exercise. Fully support that. That's your endorphins, your feel good hormones, but it's not the same as actively supporting that parasympathetic through like mindfulness, through meditation, through forms of yoga, breath work, massage, humming, chanting, some really simple things you can do on a daily basis just to support the vagus nerve. So I really love that as an invitation for women to really start making that as important as what they're deciding to put on their plate that day. And that can be really influential. And sleep as well. I tie sleep into that too, because sometimes the women will realize like, look, oh, like these nights I'm not sleeping well. Well, what was my blood sugar doing? Oh, look, that night you had this for dinner, and then maybe you had a dessert, and then you went right to bed, and your blood sugar was elevated through 3 a.m. You didn't feel so good. You woke up at night. The next morning, you felt more fatigued. Let's compare that with another night where maybe you had a more balanced meal at 6 p.m. You didn't eat again, right? So you had like a fasted window. Your blood sugars were lower and stable throughout the night. You noted on your journal, you woke up feeling more rested, had a better night's sleep. And so that in itself, for some women, they're like, oh, this is fantastic. I know what I can do, right? I know what's going to support me. I also know what's not really working for me. And one of the things I love with that so much is for a lot of women, they almost intuitively know, right? They might know there's something that maybe they're doing or not doing, right? That might be driving a symptom that isn't ideal or something that they want to try to address. And then maybe seeing it in the actual data, they're like, okay, this like really makes sense. This clicks for me. This is a place where I know that I can really step in and make a change that's going to ultimately have an impact to lower those blood sugar levels and keep them more balanced.
Yeah, and I love that you've explained some of those thoughts and suggestions around managing stress and sleep, and not actually mentioned anything around nutrition and your diet, because this is what we have to help women understand, isn't it? That it isn't only about what you eat. Your diet is very important, and I'd love to just move on to that next, but it is one piece of it, and your blood sugar is being influenced by these other habits and ways of thinking and doing that you have in your life. And I was smiling as you were giving an example of maybe that type A woman, go, 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 because that was me. You know, I lived in a chronic state of stress and high alert because I'd struggled with anxiety and panic disorder for many, many years. And I had no idea that that was, you know, probably going against, if you think of it like a tennis match, I was putting in the good food and trying to control my weight through literally the diet that I was on. But the diet outside of that, in terms of what was fueling me with thoughts, with, you know, the sleep, high levels of stress and so on, it was just like a to and fro, you know, back and forth game of tennis, because I was just, you know, detracting from the good nutrition I was putting in, because most of my other lifestyle was very detrimental to what I was trying to achieve, which for so many of my adult years was just losing weight and being a certain weight. And even now, a bit like what you mentioned in perimenopause, you know, my weight has shifted and I have the healthiest diet I've ever had. You know, I'm very consistent in how I eat. Yeah, I have odd treats and I have some ultra processed foods, but it's a very small part of my diet. You know, I think we've all got to realize it's very almost impossible to eat, you know, 100% good, for want of a better word, all of the time. But my diet is pretty, I would say pretty good. The best it's certainly been through my life. And yeah, I'm struggling to lose weight, but I know that there are all these other parts. And the missing piece for me is getting underneath the bonnet, so to speak, to get some data to really see what's going on with some of my hormones, like the blood sugar and insulin and cortisol and things, to really see, because without that, you know, we are kind of trying to create a plan blindly, but at the same time, that's the reality for most women. You know, I can't afford to do that for myself right now, even though I've got that knowledge about what that could bring me and benefit in how I switch up some of my habits and choices and so on. But, that isn't possible for many, many women. But at least having this awareness can help you to shift from maybe just being really harsh on yourself over what you eat and actually not eating very much or very much of the right stuff, which is what I see a lot. Women are eating very little amounts of food, but eating very poor choices of food, very low nutrient dense food, still lots of processed, ultra processed foods, well, it's low fat, that's fine. But to shift into nutrition, then some of it means we do have to leave those beliefs that we've heard since, especially, the 80s, around eat low fat and eat less, and focus on now, the obsession over high protein, but not necessarily good high protein choices. So what would be some of the advice around nutrition and diet that we need to consider to help? And actually, one thing I just wanted to say, Bev, was I think it's important to call out that it is normal to have these peaks in blood sugar, but what's not normal is to have excessively high peaks, is it, in those frequent high peaks. So if somebody's a snacker, for example, and they're having these high, really regular high peaks, for example, in the old Weight Watchers days, which some people are still in, it was like eat at 8 o'clock, eat at 11 o'clock, eat at 1 o'clock, eat at 3, snack, 6 small meals plus snacks and so on. So yeah, it's normal to have them, but just abnormal if they're really high and frequently high. Is that right?
Yeah, yeah. So as far as that too, the looking for what I say, we want to look for like rolling hills as opposed to these mountain peaks.
Mm-hmm.
And we know with these mountain peaks, there's research to support that that is a form of stress on the body, particularly cardiovascular stress, oxidative stress, stress to our microvasculature as well. So yes, we might have incidences where we're going to have a mountain peak, right? You're going to have the birthday cake or something. And for someone, if you tend to be more carbohydrate sensitive, which we can see with women, especially in perimenopause and menopause, like you might shoot up to a huge mountain peak. Now, there's certain strategies that we can do to try to mitigate that from happening. But we also, if we can get to the point of metabolic flexibility and we have that, it's going to happen, right? We're going to have the birthday cake. Where it becomes an issue is when every meal you're having or every snack you're having, you are going up really, really high into this spike. So this less than ideal range. I usually recommend like a 30-point range. We're not going completely flat. If you're on a ketogenic diet, you're going to have a fairly flat curve. I find most people I'm working with are not. So we're going to expect these fluctuations, but we want to try to keep it in a little bit of like a tighter window without these big jumps. And oftentimes people feel much better without having these big spikes. Once we kind of reduce those, we can have a downstream benefit, of course, of weight loss because we're basically going to have less insulin being, coming and being released every single time. But I love it too for people like you had mentioned, like cravings or low energy. I've had people who, if they've just smoothed that out a bit, they realize that after they eat, an hour or two later, they're not going to the vending machine. And the reason they were doing that is because they spiked really high and the body's smart. It's like, okay, I had a ton of sugar, insulin's released. Sometimes it overshoots. And so it pulls the blood sugar down real quick, right? And sometimes even quite low, not dangerously low, like you're going to pass out. But then ultimately, what is it going to do? It's going to be like, I'm starving. I need energy. That's what the cells are going to be craving something. So what do? You're like, I got to eat. I got to eat. I got to go get something. And oftentimes the body's not stupid. It's going to choose a carbohydrate. It's going to choose glucose. It's going to choose energy. So sometimes you see these patterns of like this yo-yo going on, and then that doesn't feel good. You're sleepy, you have low energy. And then you learn to kind of level that out. And you're like, oh, like I'm not going for the bag of potato chips and the Coke at the vending machine at 2 p.m. anymore. I'm not going for the venti latte, right? So there's these downstream consequences that then people are like, oh, that was, related to my blood sugar. So yes, it's not about having a flat curve. There are ideal ranges that I like to see people in as far as like their overnights when they're in a fasted period. We know that, it's more damaging to have higher glucose levels overnight when we're fasted. That's definitely a target for people. If that's high overnight, we need to really look at that closely and see what's going on. During the day when you're not eating, there's like a range that could be more ideal to see where someone's at, as opposed to when they're eating and after they're eating and what that looks like an hour or two. So there's definitely a lot we can look at with the curves, and it's very personalized, right? So when we're looking at these, and that's why I love supporting people through a nursing lens as well, and not just having somebody, put on a monitor and be like, what am I looking at? Is there some nuance to this? And it can cause some stress. It can cause some anxiety if you don't know what you're looking at, right? Or you don't understand how all the pieces fit together. So it can be really helpful to work with somebody who can kind of look at the big picture for you and help you know, where can we focus? What is worth focusing on, right? What is an area that we can optimize this? What is an area of we're not really going to touch this right now? And that's really where I think this as a helpful tool comes in. Again, it's never just about collecting data, but it's about what are we going to do with this? And everybody's glucose curve is going to look different. That's the thing. I've looked at so many of these that you never know what you're going to see. There's some patterns that start to emerge that you're like, okay, so I think these are the things that can help you. But it's like a fingerprint, right? Everybody's their shifts throughout the day is really different and really unique to them.
Yeah, and that's a point worth making, isn't it? That you can't compare yourself to other
Mhm.
people because the way we react to the foods we eat is so unique. And a lot of that is down to our gut microbiome and then the rest of our health, how stressed or tired we are. We know that sleep really does play around with our hunger and satiety hormones and so on. So yeah, there's just so much in that blend that makes each
Mhm.
one of us unique.
Mhm.
And certainly for me, when I really focused in on my nutrition and started changing my diet in 2017, but it probably took a couple of years or so. I used to still snack, but snack differently to how I used to snack. But now I rarely snack at all. And I meet people in my work, clients or just people I chat to who ask for advice and so on. And, they're sharing about how frequently they're hungry and that
Mhm.
reliance they have on that afternoon snack. And I think most people just have this belief that, if I have something sweet and stodgy at 3 o'clock, then it's going to curb, the
Mhm.
tiredness that's coming on. I'll have a cup of tea with a big spoon of sugar and a chocolate bar to accompany it or something like that. But I don't need that. And that's quite a cultural shift, I think, to make for many women, isn't it? So
Mhm.
on nutrition, what would be kind of your core principles that someone could think about for their diet to try and, as you say,
Mhm.
create these nicer rolling hills, or at least know that they're doing what they can in their diet to help that be the pattern rather than have these big peaks.
Yeah, so just simple concepts are thinking about just creating a balanced, balanced meal, a balanced plate.
Mm.
So when we say balance, I'm always looking at, do I have like a quality source of protein, right? So this could be in the form of animal-based proteins or plant-based proteins. Or this could be having some fiber on your plate. So we talk about fiber, I think of like the lower carbohydrate. So for me, that's like dark leafy greens, lots of vegetables, the non-starchy vegetables. So I'll contrast that with when I say starchy vegetables, that would be like your white potatoes, sweet potatoes, and like squashes, I would say are probably my top ones that people are eating, that I kind of treat those as I would some rice or pasta. I really put those in that starch component. So do we have some good protein? Do we have a good amount of fiber? And then some healthy fat in the form of maybe some good quality oil, nuts, seeds, those kind of go in the fat, and the protein thing for the nuts and seeds as far as that contribution. But really, when you zoom out of that, you're not looking at something as simple as it just a simple form of carbohydrate, like you mentioned, like a biscuit. So just using like your little afternoon like treat like that. So you have the sugar in your tea, you have a biscuit. That's all going to be broken down to glucose, which is then obviously you're going to see that impact on your blood sugar level. And so if you're somebody that's sensitive to that and that glucose is coming up, it's going to be floating around. You're going to have insulin come in to try and then bring that glucose back into the cells. That is kind of that picture we can see of that spike and that drop. So if we were going to look at a snack like that, it's like, can I balance this out? Now, maybe you say for a snack, it could be more challenging because you're like, I'm not going to eat a plate, green leafy greens before I'm having my tea, right? But when I love like my favorite snacks for people are just like if you're gonna have like that piece of fruit, can you have like a handful of like nuts, healthy nuts with that? Can you have maybe a little bit of cheese like that if you can tolerate dairy? I love, like, if meat's part of your diet, like clean grass-fed meat sticks. So balancing out, you're having obviously the sugar, which is in fruit, which is great. There's so many beautiful properties to fruit that we want to be including those in our diet. But if we're sensitive to that breakdown of that sugar that we're getting from the fruit in the form of fructose, we can maybe balance that out nicely, just having some bit of like protein or healthy fat with that. So similarly with plates, whenever I'm building a plate, a bowl, I'm just like, how nutrient dense can I make this? That's like a challenge I always like to ask myself. And so again, shifting back to like not how many calories are in this, or a child from the 80s, how low fat is this? Like, I'm so happy
Yeah.
to have released that. I'm like, how nutrient dense can I make this? I'm just like, do I have a protein here? Do I have a fiber here? And oftentimes this is like, what's in my refrigerator? What do I need to use up? What vegetables can I use? Can I drizzle a little olive oil on ahead? I keep my pantry stocked with hemp seeds, chia seeds, flax meal, basil seeds, like anything that's going to add fiber. It's going to add some omega-3s. It's going to add healthy fat. So I really take on this layering principle and getting creative with it too. Like, I try to get out of the box. Like, I don't need a recipe for this. These things just can kind of blend together. They give really good nutrient density. And most important, they're going to give you the most balanced blood sugar when you do consume them. So kind of takeaway with that is there's always going to be kind of that space really in quick carbohydrates. That's what processed foods are out there. That's what's marketed to us. The cereals, the chips, right? The pretzels, the crackers. When people say, I want a snack, I'm always like, can we pick a more nutrient dense snack? At least maybe most of the time, or at least maybe once during the day, instead of having that be like, oh, my snack is always my biscuit. My snack is always a bowl of popcorn, right? It's like, okay, can we dress that up? And my hopes with that too is again, and this can be more difficult for women, but then they're like, well, that's too much food, right? They're like, how could I have like that, the banana with like the nuts or something like that. And so that is breaking down some misconceptions over, calorie restricting and calorie counting, and being like, let's make this balance and make this more nutrient dense. And have often found too, because I do have people doing like dietary journaling when they're using the CGM, is how much many women are under eating. And that's really evident when we start looking at that. So we see gaps in not only the quantity, they're really being calorie restricted, but then also seeing like you're missing some really key like macro and micronutrient targets that could actually be sabotaging your efforts to, whether it's lose weight, right? To have more energy, to have less fatigue. And we really need to look at that because, our food is our fuel, and what's in it and the components of that are really important to help us feel our best. So those are some of like the basic concepts. And I would say from a meal timing perspective, for some women, they really do very, very well with being mindful of their choices of their last meal and not eating really close to bedtime, or being really strategic with what that choice is. Because as I said, we really don't want to be driving those blood sugars up when we're getting ready to go to bed, and we need to be in a rested state. The body goes through so many biological restorative processes overnight, and we really don't want it to be tied up with trying to bring our blood sugar levels down for that period of time.
Personally, that's one of the things that I've noticed over the past couple of years as I've really improved my diet further, and focused on timing of when I eat, and really having that longer window of not eating, making sure I'm not eating late at night, and on a weekend, if maybe I've eaten slightly later, or perhaps had food that I wouldn't eat as much of during the week. I do often cook at home. I don't get takeout very often at all. But if I've had something slightly different and heavier, and especially some alcohol, then I find that my sleep is really disrupted. And sometimes I almost feel as though I've got that racing heart, that adrenaline feeling of oh, and I had this actually just a couple of weeks ago, and I'd been drinking alcohol in the afternoon. I'd been to a friend's hen party and come home and then had some food, and it was all done by like 8 p.m, but I still had that feeling. And so I think if you get curious with yourself and how you are feeling, you can pick up on these kinds of things, can't you? And I've definitely noticed for me that I'm just not able to eat as late as what maybe I had when I was much younger, that it definitely has a detrimental impact, not just to how I sleep, but to how I feel overall. And so I'm, enjoying my kitchen's closed by 8 p.m. latest. Usually it's earlier, 7:30. This year I have been trying to make it a little bit earlier, but with work and family dynamics, it's not always possible. We do eat dinner in the evening together most nights. So, that's it. There's no snacking after. I don't need a snack. I'm satisfied. But I know I work with clients who are astounded when we start diving into their eating patterns. And, I suggest that maybe they should give that 10 p.m. packet of crisps or chips, as you call them, and a glass of wine, or even a hot drink at that time of night, a swerve, and try and create some different habits. It's quite alarming, but people don't realize, how much, because again, most of who I work with are really fixated on calories. This has been their life for maybe, for some of them, 40 years, since they were a young teenager, and
Mhm.
having to switch away, as you said, from just focusing on quantity and think, well, it's okay to have that because I've not eaten much today, but actually realizing that it isn't about the volume. It's that you're eating late at night, or you're eating much, higher processed types of foods and sugar and so on. So
Mhm.
lots, hopefully, that people listening can really lean into and think
Mhm.
about. One thing I did just want to ask you, I'm just curious to get your point of view on this, Bev, before we wrap up, is there's, like I say, quite a trend at the moment. I'm sure it's the same in the US as what it is in the UK with blood sugar. And you have the glucose goddess. I'm sure you've
Mhm.
come across her online. I've listened and watched quite a few of her things, and I think she's got a lot of valid points. Obviously, she's a scientist doing a lot of research. But at the same time, I feel as though she's maybe allowing some people to interpret what she's sharing as, oh, well, all I need to do is have like a shot of vinegar before I eat something, and it's going to offset that spike and fix a bit,
Mhm.
like, getting the prescription from your doctor, as you know about, and just taking that pill, but not actually fixing the root cause. What's your thoughts on her approach and some of what she's putting out into the world?
Yeah, so there's a lot of like we call like blood sugar hacks that are out there. So
Yeah,
I
hacks.
feel like when people are curious about that, I do get those questions. So it's never a place I start with people just because, again, we want to kind of understand this root cause. So
Mhm.
with the vinegar one, I'll address that. So I would say that it is helpful for some people, not for other people. So I've had some people, if they want to try it and they're wearing a continuous glucose monitor, absolutely, you can give it a try. But it's not necessarily a hall pass, right? To mean that, oh, I'll just, have this before anytime I'm going to have a meal, and then I don't have to think about it or worry it. That has not been my experience, but I wouldn't say that the people I'm working with are necessarily looking for that one thing, which is good. I feel like, if
Mhm.
I'm in a conversation with them, we're talking about everything you and I just spoke about. So, as far as harmful, I would say, there can be damage to your teeth. So, people should use it with a straw, they should dilute it, and it can cause GI upset for some people. So you can definitely get some cramping, bloating, which doesn't feel good to anybody. So definitely not one for quick fixes. But if somebody wants to try it, but then if you're not really looking at it, is it helpful, right? So if you don't have the benefit of looking at it on a glucose monitor, is it something that you're doing unnecessarily? So I always like to kind of teach more on like the principles, which I know she does as well. I mean, certain
Yeah.
ones as far as being like, we want more protein, we want to be fiber first, why fiber
Mhm.
is so important. Even when we're eating a fairly healthy diet, I've just even learned this for myself because I've really been trying to increase my fiber content. And I eat a lot of fruits and vegetables, and it can be hard to get to that number. So but it can be something that can be really helpful to focus on. There's good studies to support a higher fiber diet,
Yeah.
is really helpful for lowering blood sugar levels and metabolic health in general. So I always kind of promote that people utilize that because there's also such wonderful benefits from eating fiber from a microbiome standpoint, which I know we didn't even really touch on. But so nothing wrong with doing that fiber. If you have issues tolerating fiber, then I usually say take a deeper look, like working with a dietitian, working with a functional medicine provider, gut testing, things like that to figure out maybe
Mhm.
why you can't advance the diet to include more fiber because there's probably something deeper going on. Like walking after meals, we talk about those things. That's such a like easy thing that someone can do. And that is definitely going to be helpful for people. So much so where people just know, like, I am going to, walk, 15, 20 minutes after my meal. I know that any rise that I might have that might be a spike, like it's going to help that come down. So again, if it's like I'm having the birthday cake, I had the big meal, I had something, because it's not about, we're not perfect all the time. What
Hmm.
an easy thing to do, to be like, I'm going to go out for a walk, right? I mean, some people even leverage that to like, I'm going to do, 10 sets of, like 20 squats or something like that over 15 minutes, just really trying to leverage utilizing the muscles to soak up that sugar. So those are the things which people call hacks. And I like to educate around, but in the context of the bigger picture, right? Where I really think it's important for people to understand where are they coming from this? What are their motivations? Is it a diagnosis, right? Is it just they want to optimize your health and you've heard having balanced blood sugars is a good thing, right? Going for a walk is good for everybody, right? So we're not going to, there's nothing wrong with doing that. But I think it's important to understand the bigger picture, how the body's working, how we're utilizing sugar, and then employing, hacks is one way to say it. I like to say strategies, right? That are going to help us stay a little bit more balanced. But there's definitely, there's supplements on the market. And
Hmm.
this is like a huge industry right now, right? There's
Mm.
supplements that people can be taking, and there are some good research behind some supplements that actually are supportive of carbohydrate metabolism, blood sugar regulation, whether they're, a particular specific ingredient, like something like berberine, right? Or if it's a targeted probiotic, there's some research going on in the particular strands that can really support blood sugar regulation, GLP-1 production, as such, like that. But again, I think it brings us back to the beginning. It's never going to be the one thing. And that's what I always like to educate. And so, yes, do I work with someone, they're doing all the dietary stuff, they're doing the lifestyle, and then they're like, something's still not quite right. It's like we might need to go a layer deeper, right? We might need to be looking into the gut microbiome. We might need to be seeing, what would we do to support there? Maybe we're pulling the lever on a targeted supplement. But it's everything in the context of what's the big picture here, and not the
Mm.
one thing.
Yeah, great advice. So to wrap this up, I mean, you've given so much valuable information and some great strategies that people can consider trying to bring into their life and build some habits around. What would be three simple steps you'd suggest that someone could take to start to improve their management of their blood sugar without having that, data insight, which ultimately is going to be something that would, enable them to take that much further?
Yeah, so I think a simple habit, I encourage everyone to get annual blood work, right? So I think out of the gate, knowing your metabolic markers, this conversation might not mean much to you if you don't know what your numbers are. So I would say annual blood work every year, just see where your blood sugar is at, see what of your other metabolic markers are, number one.
Mm.
Number two, I would say that increasing your protein. So I'm going to target this especially for women, because I see this so commonly with women that go kind of fasted through the morning. Maybe they don't eat, they do a strenuous workout, they're eating a little bit later in the day, is really trying to get in like a good like 30 grams of protein first thing in the morning. And yes, there's a lot of buzz around protein, but I really do see this in practice to be very, very supportive for women to balance out their blood sugar levels, to give them more sustained energy, to help them balance their curve if we are monitoring with a glucose monitor. But you wouldn't even need the monitor to know that. Just see if you feel better when you introduce like a high quality 30 grams of protein and some fiber into that meal. I see a lot of women maybe do black coffee with a piece of toast, maybe just a like a processed bar, right? Some sort of a
Mm.
bar in black coffee, things like that, and just see and be curious and to be open to having that be a little bit of a bigger, more nutrient dense meal for you. And even if we aren't talking about blood sugar here, even from an energy standpoint, mood stability, satiety, I really do encourage women to give that a try, even if it's for a short period of time, something that you can do. And I would say number three, we didn't dive into exercise, but for me is some sort of a strength training routine that you're doing. From a blood sugar standpoint, it's really important to preserve and build skeletal muscle mass. So we want skeletal muscle because think of it as your sugar sponge, right? And it helps support insulin sensitivity. And we need this. So after the age of 30, we start losing our muscle mass at a pretty high rate. So anywhere from like 3 to 8%, it's going to go down every 10 years, which is huge. And then after 60, that really accelerates. So if we're not actively doing something to build that, we're going to be trending towards more frailty as we age, sarcopenia, the medical term, which obviously is going to impact us into our later years. So I'd say for women, so many of the women I work with have never picked up a weight. They're intimidated by weights. They don't want to be in a weight room. But just getting that guidance too. You can even start with body weights if you're uncomfortable around dumbbells. But simple things is just body weight workouts, just some squats, if you can do some push-ups during the day, anything that's really going to exert that force on that muscle, because that's where you're going to build. We want that muscle under tension to help build up that skeletal muscle, also from an insulin sensitivity standpoint, but obviously healthy aging as we go, because it's not going to just maintain itself, and it's not going to build from nowhere. It ties nicely into the protein piece because we need that protein. But I encourage you, if you're just doing the HIIT workouts and you're go, or you're running or you're swimming or doing yoga, I love all that. And I think that's all important, but I really do emphasize that women do work on strength training, especially in midlife. And if you're uncomfortable, there's so many people out there that can support you to get started in a way that's going to feel good for your body and be safe too.
Yeah, exactly. And I advocate strength training. It's one of my pillars, sits in my movement pillar. And if you are listening and thinking, yeah, this does scare me, I'm someone who hasn't ever lifted weights, I don't want to go to a gym. There's so many ways you can bring strength training into your life. I do have my menopause boost, energize and elevate 5-day program. And I actually give little recordings of workouts, and I've had brilliant feedback from clients, even ones who've been training but are doing it wrong, things like a deadlift. I really talk you through the technique on that because I'm qualified as a personal trainer. But yeah, just getting that right advice and bringing this into your life is so important. One thing I will add on what Bev said there about the blood work is, in the UK, we do have a different healthcare system with the NHS to how your private system works. Usually there has to be something wrong, which is so wrong in itself, to have a blood test taken. We don't get those annual reviews and stats, of the key health markers. But you can ask for that, and it doesn't have to be something detrimentally wrong. You can even say, I'm in perimenopause or menopause, and I'm really aware of a lot of the metabolic changes that happen, and I would really like to get my blood work done to check my fasting glucose and my HbA1c, which you mentioned at the start as well. And pop me up, ever know if you're not sure what to ask for, and maybe there's some of the ones you want to include in there while you're getting them tested. And I've had mine done twice in the past couple of years, and it is easy, but it's not something that will happen unless you have a problem, which we're trying to avoid reaching that point of, or you are I forgot what the other thing I was going to say. That's my menopause. Yeah, unless there's something wrong, or you being tested for something else, and then they maybe say, "Oh, we'll add that on." So yeah, you are entitled to actually ask for that. And yeah, I think that's great advice. Protein is a big topic. We could have done a whole podcast just on protein and on strength training. We've got one, recently just on the power of moving your body and exercise. So lots to take away from Bev. And if you are interested in finding out more about Bev, I'll pop everything into the show notes. But just let people know where the best place to reach you is. And you do have your free guide as well, which I think can add some extra value on the back of this conversation.
Yeah, absolutely. So you can find me on my website is www.purelypresenthealth.com. So that's the name of my business. I'm on Instagram at purelypresenthealth. I do have a fairly active mailing list. So if anybody's interested in this topic around blood sugar balance, functional medicine insights, integrative health, those are the kind of topics I speak about in my newsletter. So I'd love for you to kind of hop on that and join the community. You can do that just, signing up to join, or as I said, I have a free resource that I am offering. So it's the complete pre-diabetes checklist. It's really 10 steps to help lower blood sugar for women in perimenopause. So a simple checklist that is some of the concepts we spoke about today. People find it helpful maybe to print it out, put it somewhere just to kind of keep it top of mind and focus of some specific things you can do. One of the which is starting the day with some protein. There's a couple other tips on there too to hopefully just kind of get you started on that journey.
Oh, amazing. Thanks. And as I said, all of the links you can find in the show notes or go to the episode page on lifenow.uk/podcast and you'll find Bev's episode there. So thank you so much for all of your knowledge and inspiration, guidance. Bev, I really appreciate it.
Thank you for having me.
You're welcome.